few moments I will demonstrate this on a skeleton, and then if a person with a bathing suit would be willing to come up, I'll demonstrate it quickly on them. Again, remembering up here I'm not treating, I'm basically teaching techniques, so we will go faster, always faster than actual treatment. So step number 1 is the LumboSacral Decompression. Step number 2, the sacral float. Step number 3, the pelvic/sacral release. Now take a little curved line between step 2 and step 3. We tend to combine them together for effectiveness. So yesterday we been talking about this dysfunctional situation that most of us have gotten into. And what happens to the vast majority of people, over 90% unfortunately, is our pelvis, our foundation, is pulled forward in space, usually with a twist in the system. This creates a situation where the anterior myofascial structures of your body are doing their job by tightening down in an attempt to stabilize you. They're tightening down three-dimensionally, front and back, side to side. And over time, your neck and head gets pulled forward. Now we have all these posterior strain patterns. The tightness now is pulling the joint surfaces together, twisting them, jamming facet joints, bulging discs, putting pressure on the nerves, etc., etc. And we end up having symptoms throughout this area. And traditional therapy treated the symptoms as if that was the real problem. And it's only the tip of the iceberg. So our goal with everybody is that wherever their symptoms may lie, is bring their pelvis back under them. Open up the area three-dimensionally, bring the head and neck over its support system, creating a mobile, spacious, and fluid environment. Now you're going to have the person lying on their back. You'll explain thoroughly what you're doing. You will then ask them to lift their pelvis. You then come between the legs so you, the therapist, can get a straight line pull of the sacrum. So your hand will be on the sacrum. I'll just turn the person so you can see where I am. You're going to mechanically pull the sacrum toward the feet without sliding on the surface. We're going to use the same principles as we did yesterday on the cross-hand release, but because of the body weight, we're not going to cross our hands. That will be our counterweight. The other hand will be just at the lumbar area. As a flat hand or a fist, it doesn't matter which way. It's whatever way gives you a better grip that day on that person. And what we're doing without sliding is open, opposite directions. I'm going to get into a low lunge position as the therapist. Flex one knee, put the other leg behind you. I'm going to rest on my elbows. I'm going to make sure my back is straight. I'm going to get into a relatively comfortable position. The other hand will be here. Now, what we'll be doing is having the patient squeeze their ilia together like an accordion. And as we do that, we're opening up the sacroiliacs posteriorly. So we're getting a lot done in a short period of time. The hard thing is holding your patient like this. Just kidding. So we're like this. We wait for a while. Now my hand, the thing you will tend to do is narrow your hand and grip the sacrum. That will make you truly miserable. Relax. Let your hand be very soft. That will give you a good enough grip. And then I'm not going to use brute force to pull. I just lean back with my body weight. The other hand pushes up as more counter pressure. So the lumbar hand pushes up toward the thorax without sliding. This hand, with body weight, pulls till I come to a stop. If you remember yesterday, without sliding, the first give you feel is the elastic and muscular component. You then come to a dead halt. That will be the collagenous barrier. We wait there, give it time, and eventually, somewhere around 90 to 120 seconds or longer, as the release occurs, it kind of feels like butter melting, and the sacrum kind of starts to open like a ratchet. You just follow it as you continue with your body weight to pull toward their feet. Then, we'll have the patient ease the pressure on their ilia. Now, if the patient is too weak, their neck may hurt arms may be weak, then you don't have to do the squeeze. It just works better that way if they can, and most people can, or you can have an assistant do it. Then I'm going to slide the lumbar hand out. That initiates step 2, the sacral float. The body weight, gravity, the breathing mechanism, and ultimately our hands. What's happening now with the sacral float is the ilia are beginning to drift toward the table. To maximize that effect, the hand was on the lumbar now. I place on the lower pelvic area, just above the pubic bone, on the soft tissue, soft hands. The hand on the belly now very slowly drops toward the depth barrier, toward the table. As I feel resistance, I just nudge into gentle pressure, like I'm making handprints in soft clay. And then without sliding, I will push up toward the rib cage, stretching out the elastic and muscular component so I come to that dead halt, and that's where I wait. So if you just imagine between my hands, it's a cross-hand release, and we're opening up everything in the pelvic bowl, lumbosacral area. Let the patient know if they need work in this area, when they have restrictions, have that Indian burn effect. Let them know ahead of time so they don't get scared, because it can get intense. Make sure you've explained to them the difference between therapeutic pain and joyous pain. They have total control. I always have a control word between the two of you. For the seminars, as you know, we're using halt. So as I'm pulling, my hand has dropped, and then I push, and I wait, and eventually as the release occurs, feels like butter melting, open up a little more, and maybe again. So this is a wonderful sequence that the vast majority of people need. You'll use most of the day, and it'll never injure anybody. You just do not do step 3, pushing on the belly with the pregnant lady. The rest of it is important for anybody that's pregnant. If somebody could come up with a bathing suit on now, let's go through that. That's okay. Let's just lay down so your head's not in a hole there. Just go that way a bit. Just go that way. That's good. Okay, bend your legs, please. You explain what you're doing. You need to come between the legs. You have a straight line pull of the sacrum. If you could lift up, 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 up. Slide up under the sacrum. Come down very slowly. I've had a number of people whip down on my hand really fast, mobilize them beautifully. So slow. Put your legs down. I drop to my forearm. Flex one leg, put the other leg behind me. This hand now goes under the lumbar area. Just arch up for a second. Okay, and relax. Okay. Now the hand under the lumbar area is pushing up toward her thorax. The sacral hand now, I'm going to use my body weight just to tug toward her feet a bit. Take the slack out of the system. So it's like a cross-hand release without crossing your hands. So I've stretched out the elastic and muscular component. And I wait. Get in the habit starting today to start to feel between your hands. Your proprioceptive senses are capable of doing that. You will learn over time to use the fascial system as your antennae, enabling you to reach deeply in the body with incredible accuracy. So again, I'm going to go through this fairly fast, more for demonstration purposes. But when I do get a release, I keep pulling the sacrum toward the feet without sliding on the surface. Small motions, but very important motions. Somebody once was trying to annoy me, more than once, but and basically said, well, these motions are so small, how could they be possibly important? I said, well, how big's a nerve? 2,000 pounds per square inch, that's 2 full-grown horses standing on a nerve. I'd say that's pretty important. You squeeze your ilia together now. Good. And you'll feel the sacroiliac gap open. Now, always explain to your patient what the ilia is. Otherwise, they tend to squeeze their buns together, and that doesn't do you a lot of good. And also, make sure your hand is on the bare sacrum. Let's say now I've been here for at least a couple more minutes. I can ease the pressure on your ilia. My hand throughout, with my body weight, continues to pull her sacrum toward the feet. You can release your hands now. Good. The lumbar hand slides out. Pubic symphysis is right about there. You must be on the skin, but this is where approximately I will be, just above the pubic symphysis. My hand is soft, contouring to her shape. I will drop into the depth barrier until I feel resistance. Take your time, there's no hurry. The patient feels the rush in your body. It shuts them down. Still dropping toward the table. As I feel resistance, I just kind of nudge into it gently, kind of like I'm making handprints in soft clay. Sacrum just released again. I'll take the slack out a little more. Now, without sliding, the hand on her belly will push toward her thorax. The first give will be the elastic and muscular component releasing. You'll come to a dead halt. That'll be the collagenous barrier. Sometime today, if you can, or tomorrow, remind me to talk to you about the amber story. It has a lot to do with the collagenous barrier and helps to better understand tissue memory and how it may be locked into the system. Every time a release occurs, it's going to feel like butter melting or taffy stretching. There is an art to this. Don't worry about it. You will get the feel, but take all pressure off yourself today to have to get the feel. Just allow yourself to be quiet. As I said yesterday, this is a physical learning we're doing. It goes beyond intellectual learning. Just allow yourself to get it without worrying about it, and it'll come to you in its own way at your own pace. Even doing this mechanically, you're going to have superb results. But as you learn to tune into the feel, you become a true therapeutic artist. Is this hurting you? I don't know if the camera's picking it up, but under her chin, hyoid region, cheeks are getting very red. Vasomotor response. Always look for the vasomotor response. It's totally unpredictable. It's different with everybody, every day. Body's lighting up like a Christmas tree. It's trying to get your attention. Say, treat me here. And wherever they had a sensation, as illogical as it may seem, treat those areas. Your left brain will say, what the hell does that have to do with the symptoms? If it's in their body, it has everything to do with it. We have to stop being linear. We've deprived ourselves of the wisdom of our body by trying to apply linear principles to a nonlinear system. She's releasing, and my hand is being pulled to her left, and I can feel a drag on her anterior sacral area. Now my hand's being pulled a little bit toward midline, so I'm still engaging the barrier, but I'm allowing the tissue to unravel and unwind. Remember, it's like a rope. The fascial system doesn't let go at once. It's like a few strands at a time. You feel that as the therapist as a changing tension or motion. So you engage the barrier, but you allow the body to spontaneously move, and that just magnifies the result. And again, I'm going faster. I'm going to ease my pressure slowly, always slowly. Can I slide my hand out? She has my fingerprints here. She's boiling here, bright red here. And if you just roll your belly toward them a minute, if you look at the right side of her belly, do you see the vasomotor response on the right there? The body's just told us next step. Again, it's very direct. It's right in front of us. Can you let them know what that felt like?
It felt very soft at first. I was surprised. And then by the end, pretty intense up under my diaphragm. Yeah, I would take more.
So what do we see? Red here, red here, red here, and intense under her diaphragm, so that she would be a good candidate for the next technique, the respiratory diaphragm. Remember, it's so simple, your left brain will reject it. So just bypass the left brain. Thank you very much.